so much for joining us this afternoon with our Facebook Live platform. We're looking forward to questions that you have posed for us. I am Dr. Amy Stevens. I'm a family physician here at UT, and I'm the Vice President of our Primary Care Collaborative.
Hi there, everybody out there in Facebook world. I'm Dr. Jenkins, family medicine over at Rocky Hill Family Physicians, and glad to be here talking with you all and hopefully addressing some of our concerns about the COVID pandemic.
Hey there, I'm Jennifer Piel. I'm an internist with UT as well, and I practice primary care at North Shore. Happy to be here.
Great. So the first question we had for you, Dr. Piel, is just how are you currently seeing the COVID situation affecting your patients and the community?
Sure. So, I think that the past few weeks have been pretty discouraging for a lot of us because we really felt like, we're coming out the other end of this pandemic, and then we saw this recent surge with Delta really being primarily responsible. I think the positive, if there is a positive from all of this, the positive is that the vaccine really is proving to be as effective as we thought and hoped it would be. So, the vast majority of our patients, really of patients across the whole country that are hospitalized and very sick with this virus are unvaccinated. A couple of just current stats from UT Medical Center. We have 93% of our patients in the hospital are unvaccinated. Of the patients on the ventilator, 100% are unvaccinated. And the patients in the ICU, 95% are unvaccinated. So you can see that's such a striking statistic. There are a few, it's rare, but there are a few patients that have been vaccinated that are getting sick and going into the hospital. But these are patients that are not well individuals. These are patients that have had organ transplants, chemotherapy, high dose immune suppressant medications. These are not the average population. So I think it's important to note that what we're seeing right now is primarily in the unvaccinated population.
I think tagging in with that, Jennifer, is it's important to think about the fact that the thing that's really different this time around with this surge is that we're seeing it spreading much more quickly. The virus is much more transmissible. So we're seeing a very rapid increase in the numbers of people that are getting sick. And we are noting that it is impacting younger people more this time than previously.
Deja vu, I guess is what I would say. Obviously, it's been a very long, arduous, it feels like a decade at this point, but however long it's been. And it's really, we really felt like we were so close.
Yeah.
We got all of our numbers down. The hospitalizations were at a minimum. We had this well under control, and thanks large in part to our population, doing all the right things, wearing our masks, social distancing, washing hands, and most importantly, getting vaccinated. However, it is a team effort. It's a group effort. We're the volunteer state. We all have to work together on this. And the issues we're seeing now are really more plaguing those that, unfortunately, and for various reasons, have been reluctant. And I can certainly understand the concerns, the confusion, the uncertainty. There's been a lot of information, both good and bad, out there. And unfortunately, not all of it has been helpful. I want to think that people are trying to make the best decisions they can for themselves. And I'm hopeful that maybe today we can clarify some of those concerns and really help you feel at ease that making the choice to take this vaccine is really one of the best decisions I think you could do for yourself and for your family, your neighbors, your population in this great city that we live.
It's great. So we have a question from the audience. It sounds like you're all seeing this surge in our community and can attribute it to the Delta variant. So the question is, does the vaccine protect against the Delta variant? I'll start with you, Dr. Stevens.
Sure. So yes, Dr. Piel addressed this a few minutes ago, and we are seeing excellent protection from the vaccine against this Delta variant. Fortunately, there's always a risk that down the road that might not be the case, which is part of the reason you see the medical community so adamantly encouraging vaccination. But yes, one of the things that we have been able to clearly see is that if you do get sick with the virus, it's very likely to be a much shorter case, a much less complicated situation, and you're much less likely to have death, hospitalization, long hospital stay from it. So we are seeing that this vaccine is incredibly effective, as you've seen Dr. Piel talk about. And we hope that we can continue to encourage you to consider getting vaccinated so that you can be protected and we can avoid any more deja vus, as Dr. Jenkins says.
Almost, dare I say, much like a car crash, as terrible as that can be, if you're wearing your seatbelt, the odds are you're probably going to do much better than if you don't. And I kind of make that analogy that, nothing that we do is absolutely perfect. We're not going to say that, it's 100% this, it's an absolute guarantee, but at this point, I think it is the single best thing that you can do to protect yourself. The vast majority of the cases that we're seeing now that are truly problematic are in those who have not received the vaccine. And if you get say you get the vaccine and get coronavirus, generally the cases I'm seeing at least are very, mild and manageable. And we can deal with that. You take a few days off of work, you sit home, maybe you feel lousy. We do have the bamlanivimab infusion as well.
Nicely
Plug that
said.
as well. I think I said that.
That's a monoclonal antibody infusion. That's
Yes.
an easier way to say it.
Indeed. For those patients, there is an option to help them out. But if you're sick in the hospital or if you're on oxygen, we can't do that. It's too late. And so really want to drive home that yes, this vaccine does seem to be very effective against the Delta variant, especially if you've got no other protection.
Dr. Piel, do you want to speak to
Yeah,
that?
I also think it's important, I've had a lot of patients over the past few days ask me, well, is the vaccine really effective because I'm hearing about these, quote unquote breakthrough infections. And I think what the two of them already said, what we care about in a vaccine, we don't want you to have a sick day. I mean, we don't want you to feel bad, but what we care about is death and disability. We don't want you to be on oxygen forever, and we don't want you to die from this. And what it's looking like is that the vaccine is highly, highly effective against the Delta variant. The breakthrough infections are not driving the surge. The surge is driving the breakthrough infections. Unfortunately, we only have about half of our population in Knoxville vaccinated right now. And as we get more and more vaccinated, we're going to be more likely to have this be so much more effective at preventing illness in the patients that are not vaccinated.
And the Delta variant's no joke, particularly for those who don't have protection. I think you may have touched on one of the statistics, but those that are getting sick with it now, I mean, they're getting SICK sick. And this is problematic, heaven forbid, if not death, we're talking long-term disability. Some really profound life-altering consequences. And to think that something is fairly simple as the vaccine, which has just really been a miracle, that it could prevent that, I wish we could stress more how much helpful that could be.
Another question, we'll start with you, Dr. Stevens. And all of you kind of touched on this, but I think it's very important right now. But this notion that are healthy, active people not susceptible to getting COVID? I think there's a thought out there that I'm young, I'm healthy, I don't need the vaccine. How would you respond to
Yeah,
that?
I would say the virus doesn't care if you're young and healthy, if you're old and feeble. The virus doesn't care. We're all susceptible to the virus. And what we are seeing, again, with this Delta virus, it's much more aggressive. It's setting in, it's wreaking havoc in any one person's health system. And we're seeing, as Dr. Jenkins said, lots of long-term consequences. For the folks that are in the hospital, we're seeing much longer hospital stays, longer ICU stays. So absolutely, each and every one of us who is age appropriate is reasonable to be considered for the vaccine. It is the one thing that we can do to consistently protect ourselves, our loved ones, and our community.
Yeah, I've read the phrase recently, younger, sicker, quicker, and I think that
Absolutely.
we're really seeing that. It's not clear to me, and I'm not sure it's clear to anybody, whether it's because the Delta variant is targeting more young patients or whether, our older adults really have done a great job at getting vaccinated. A large percentage of our patients 65 and older are vaccinated. So I don't know whether the Delta variant is affecting the younger patients because they are more likely to be unvaccinated or whether it is because it is more aggressive. But it is so much more infectious that I think that's so important to note. The previous variants, if you had the virus, you might infect a couple of people. Now, if you have the virus, you might infect 6 to 10 patients or other people, and then those people go on to affect six to 10 people. And there are a lot of vulnerable people right now in our community. You know, we have a lot of babies and children that can't get the vaccine because they're not eligible for it yet. And so I think if we're eligible to get the vaccine, we ought to do that to protect them, and also to protect our older and feeble, you know, people that also may be more susceptible to getting a breakthrough infection, like we mentioned earlier.
So, yeah, to feel young and invincible again, I feel like it wasn't too long ago. I was in that boat myself. Now, I've had this conversation actually with a college student just earlier this week. You know, I casually bring up, hey, have you considered vaccination? And this person says, oh no, I'm young, I'm healthy, there's not a problem, it's not going to affect me. But I do kind of want to back up a little bit, because A, that's incorrect. Yes, it can affect you. It can affect you mildly. Maybe you're sick for a few days, don't feel great. Maybe you're in the hospital on a ventilator, and we're doing everything we can and dropping every expense we can to try to help you. Beyond that, though, we have to think of the community. This goes beyond each individual as well. The idea of helping eradicate a virus and truly protect our community and get us out of this hole is that we all have to work together. We all have to kind of do our part. As has been alluded to, yeah, if you're young and healthy and get sick and you don't feel great, fine. But what happens when you transmit that on to your family members? Maybe you've got an elderly, ill grandmother. Maybe there's young kids in your family. 12 and under can't technically be vaccinated yet. We need more time before we can understand the full safety in that sense. Not to mention, you all, I'm sure, are well aware, school has just started back. So as we have additional vectors that can introduce this virus to these vulnerable populations, that's incredibly concerning. So I encourage everyone out there to think not just yourself, but beyond that. Again, we're the volunteer state. We take care of our community. We look after each other. And just like we wear seatbelts, we don't drink and drive, we don't smoke inside buildings. We do all these things out of concern for our families, our friends, and everybody around us. And this is much the same.
Wonderful. So we'll ask this next question for the entire panel. Start with you, Dr. Piel. What, you know, if one of your patients came to you and just said, I'm just really hesitant, I don't, you know, how would you advise them?
Yeah, so I think that's a really great question. And honestly, I think for those of us who got vaccinated in December, you know, I think there's still a lot of unknowns, but there were a lot more unknowns 8 months ago. You know, I will tell you, I really admire the young healthy volunteers that basically volunteered to help get this vaccine sped along and volunteered for the trial. Some of them are my attendings from residency, and I just think they were so brave. But you know, really, we have a lot of safety data now. The first vaccines went in arms in March of 2020, and we're now in August of 2021. You know, we all got our vaccines in December, and so I would say it is incredibly safe. We are not seeing a lot of adverse side effects. You know, I'll shoot you straight. You know, I don't think you will feel very well after your second vaccine. I didn't. I felt flu-like for 24 hours. I had a sore arm after my first vaccine for 24 hours. But those are known side effects, and that's just your immune system doing what it's supposed to do, really, to arm yourself. I think it comes down to calculated risk. That's the crux of this. So everything we do in life, our vitamins and supplements, driving in a car, swimming, everything we do is risk benefit. And really the known risks of the COVID vaccine are far, far less than the known risks of getting the COVID virus. And I think that's what it comes down to, is you have to pick. You know, you may not trust it 100%, and nothing's going to be 100%, but you know, I definitely don't trust COVID if I get COVID. So, you know.
Go ahead.
Great point. And, you know, I had this discussion often with my patients as well, and it certainly is an individualized topic. You know, I truly believe that everyone out there is trying to make the best decision that they can with the information they have for them and their families. And I respect that to all degrees. So when I have these conversations, I generally, you know, tailor them both to what are, you know, the personal concerns, what are the, you know, the physiologic concerns, what are the conditions that might make somebody higher risk or more vulnerable, and really try to lay that out in that sense. It can be tricky, but at this point, as you've alluded to, when we look at a numbers game, we look at statistics, we look at probability. This vaccine, we're talking across the globe, billions with the B, capital B, billions of shots in arms. If we were seeing consistent problems, issues, safety problems, by this point, that would have likely shown up. Throughout vaccine testing, throughout all of our years, the various vaccines we've had, predominantly most of the problems that happen will generally happen early on, often in the first 2 months or so. We're well past that number at this point. And in the United States alone, I think we're up to 300 and something million vaccinated at this point. Almost 70% have received
Fully
booster.
vaccinated.
Yeah.
Yeah.
And so that's a pretty good data set. Millennial here, I guess, and so memes are funny. I saw one that kind of half-heartedly, said that people concerned not wanting to be a part of an experiment, well, they're now finding themselves in the control group, and that's not where you want to be.
And so to tag in with that, and I think I have a very similar conversation with my patients. You always, as a physician, you always have to take the patient in the context of their life. You have to look at the individual in front of you. So you have to tailor, as Dr. Jenkins said, specifically to the health issues, the family issues, their own personal belief systems, and what they're speaking about when they're with you. But I think the points that we're all making is everybody knows that we can't know everything about the vaccine. We don't know everything about all the vaccines that we've all been given, and I'm the oldest one in here, since we were little. We don't know everything out there. It's not possible to know. But when you think about the growing amount of information that we have that is reassuring, there's very little bad. There's very minuscule occurrences of negative outcome. And I have people tell me data points that they bring to me all the time that I cannot reproduce until you are factual. They're just not. There's a very minimal number of negative occurrences. So when you look at your scale and you're weighing things, very few known bad things and maybe some theoretical others, but a whole lot of growing negative on the COVID end. I mean, and that's increasing all the time. Every time we get a new variant, it's bigger, badder, meaner with more negative outcomes. So, when you start to weigh your options, the COVID end is pretty ugly. The vaccine end is actually the really strong way to go. And like every other vaccine that we have taken all of our lives without question, you're often going to have a sore arm. You may not feel great. I had a headache and felt a little achy, maybe tired. I think not unexpected. I've not talked to many people who have had the higher fevers or any of the more negative outcomes, but again, relatively speaking, down for maybe a day versus down for weeks or months or dead.
Mm-hmm. Yeah, we know.
They're pretty clear balance there.
And the balance with what COVID can do to you. Well, let's start with death. Okay, well, that's not fun. Well, let's start with chronic respiratory failure, being on oxygen, requiring lung transplants, organ transplants, requiring very expensive chronic medications, specialty follow-ups, surgeries, debilitation, astronomical medical bills, things that can really catastrophize somebody's life, versus a little soreness, headache, fever. I had that as well. You'll be fine. One of the things, you hear in the news, it's easy to sensationalize some of those outliers. And I want to emphasize these are very much outliers. One analogy I use is it's absolutely awful when a plane crashes. It's catastrophic, and it gets our attention. It's very exceedingly rare at a statistical point. Now, if you think about all the planes in the sky and all the people that fly each day, I don't think many people have a problem getting on a plane. I mean, it's sure maybe some anxiety, but statistically that is a very small chance. And I liken it to this. We know that there are very dangerous alternatives if you get COVID. We know now that the vaccine has been demonstrably safe across a vast assortment of patients, both age, demographics, comorbidities. We have a robust amount of data to show that this is a safe and effective way to protect yourself.
I think it's also important to note because, as a primary care doctor, I'm seeing people, all day who are struggling with various things. And I have patients who have had COVID, maybe 6 months ago or maybe 4 months ago, and they did fine, and by fine, I mean, they didn't require oxygen and they didn't go into the hospital. But they're now coming to me with quality of life issues like chronic headaches, brain fog, muscle aches,
Fatigue,
chronic
shortness of breath.
fatigue, palpitations, and these are really disruptive to their lives, and it's really affecting them. So I think that's important to mention.
For all my fellows out there, erectile dysfunction also is a known effect of the COVID process as well. Not the vaccine, but actual COVID. So just throw that out there.
Good to know.
One question from the audience, what about the thought like, well, I've had COVID, so I don't need to get the vaccine?
Yep.
Could you all maybe speak to that?
I think that's an excellent question, and I would have the same question if I were a patient. I think what Dr. Stevens said earlier, she talked about mutations, and basically we're already on our, I think, 3rd or 4th mutation. So what happens when the virus goes into different patients, different people, different host cells, it has the ability and the probability to mutate. And so right now, it's actually possible to get COVID again. If you had it, a year ago or 6 months ago, it's possible to get it again from the Delta variant, because this is a different virus than we were dealing with before. It's kind of like if you had the flu 2 years ago, you could still get the flu again. It mutates. The positive thing about all this is the vaccine is highly, highly effective against the Delta variant. My concern is that if we continue to have a low vaccine uptake, there's a chance that there could be other variants that maybe the vaccine is not going to be effective against. That's not where we're at now. It's highly effective, but 4 months down the road, I'm not sure where we'll be if we don't have more people help us stamp this wildfire out.
Body is an amazing, phenomenal, beautiful machine. That's why I think we all love medicine. It's the ultimate study. And so the intrinsic immune response that we created is certainly very profound and helpful. It's not perfect. It's not necessarily enduring. COVID's a new process. We don't know in the grand scheme of things what a person infected with COVID maybe last year, what sort of quality of immune response they've mounted. We just don't have that type of knowledge yet. So I've had plenty of patients who, they had it before and they question, well, my body's got it, I'm good to go. That's not necessarily the best guarantee. You can build upon that innate immunity by taking the vaccine, and if you can get sort of the 2-for-1 effect, by all means, that's great. I've seen various sources roughly that estimate, maybe after months or so, that natural immunity may start to wane a bit. So why not get the best of both worlds and keep yourself safe as best as you can?
I have a nephew who has actually had COVID twice. Has tested positive for it, had it early on in the pandemic in March-ish of 20, as everything was really breaking, and then in this last spring of 21, had it again. So what that tells us, and what the research has shown so far, is that those antibodies, that natural immunity, those antibodies developed from having the virus don't really hang around. Another question I've had is, I had the monoclonal antibody when I had COVID, so I'm doubly protected. I had COVID and I got the antibodies. Same thing there. Those antibodies don't hang around. You still need this vaccine, which has the ability to cause your body to create lasting antibodies, which can then protect you. So even folks who have had COVID, we recommend that they still get the vaccine once they've recovered. Right, once they've recovered.
And that's really best case scenario. If you have natural immunity plus vaccine immunity, that's awesome.
So there often is that question, when should I had COVID, I'm down, I'm going to get it. When should I do that? And at this point, I think across the board, we usually say, and once you're recovered, that's a good time. Obviously, don't walk into your doctor's office with fevers, cough, and chill and say, I'm here. But once you're over that spell, rock and roll, get it done.
There was a 3-month rumor sort of that circulated, and I think that came from, if you get the monoclonal antibody infusion, then you should wait 3 months. But if you have COVID virus and infection, and then you recover, 4 to 6 weeks, I would think would be reasonable.
And we've sent people out who have been recovered and have just needed supportive treatment in the hospital for something else that was initially caused by COVID. We've sent them out the door with their first COVID vaccine as they're exiting hospital. So I would say base that in conjunction with your primary care doctor or the doctor that's providing care for you before you make that decision, but absolutely we encourage it.
And one question from our audience, maybe that they might have jumped on here a little bit late, but just I think that's helpful for people who are just now
Sure.
tuning in. Why is it surging? Somebody's asking, why is there such this spike? And I think it speaks to what you said. Everybody's tired, and you know, we've been in this for a while, but why do you see that you think the surge is happening?
I would say if you start out initially looking at this variant of the virus, it is a more readily transmissible. Instead of infecting, as Dr. Piel mentioned earlier, maybe 1 or 2 people with COVID, if you yourself have it, you share with only 1 or 2 people. Now we're seeing that you share with 6 to 10 people, and each of them with 6 to 10 more. So that we call that more highly transmissible. It's more readily shareable, and not in the good way. And the other thing is that we just have a population of people who have let some of their guard down. We're pandemic weary. People are tired of masks. They're tired of distancing. It's been summertime. Everybody wants to hang out together. And so as the Delta variant crept in, it was here before I think we really knew it. And it had already kind of set in and was in the process of spreading. And as Dr. Jenkins mentioned earlier, it's important to think about the fact that now we're taking all these people who are sharing and we're putting them back in the classrooms together. So it's really important to think about what's going on in our community right now.
Bless their hearts, the best they can do, is wear a mask, wash their hands. They aren't
The
afforded the
best they can
privilege.
do is wear a
I was
mask
gonna
and
say,
wash
that's-
their hands.
They don't have that privilege yet. Most of you all out there do.
So I think Delta variant is responsible for the surge, and the way how it was able to, I think, get through is we just have not enough vaccine uptake. So only about 47% of Knoxville has been vaccinated, and it's about 40% in the state of Tennessee, and that's just not enough to stamp it out. It's not anywhere near herd immunity. So
To be blunt, it's a war. We're in a war. The enemy, we tacked them down. We were doing great, but it's going to find a way to seep in. It's going to find our weaknesses, our vulnerabilities. It's going to test our defenses like that. And that's what Delta is doing. It's nature in progress, seeking a way to continue on.
One of the things I tell my patients, and I'm sure you guys are doing the same thing, viruses function by survival of the fittest. They continue to change and vary and adjust and mutate so that they can survive and continue to impact our population. So we need to get on top of it now while the vaccine is still effective, before we have enough mutations down the line that we're back at ground zero again trying to build a new vaccine. We have vaccines readily available at our hospital. Here at UT Medical Center, the Heart Hospital lobby, the vaccine clinic is open every day, Monday through Friday, 8 to 3:30, and you do not need an appointment. Just come on in and we'll be glad to take care of you.
absolutely.
Wonderful. We're getting close to our time. Thank you all so much. And maybe we'll just, one last, thought from each of you, just to wrap up, if there's anything you want to, reinforce for somebody who might just be tuning in, and we'll start with you, Dr. Piel, and go down the line. Thank you
So
all.
one thing I think it's important for us to discuss today is I have a lot of patients who may have underlying rheumatological disorders. They may have underlying neurological disorders, frequent or a lot of drug allergies. And these patients have said, hey, that this or that provider told me to not get the vaccine. And when I really ask them about it now, they say, well, this was in December when it was first coming out. And I get that, I understand that. But now that it's been 8 months and we've seen so much really good intensive safety data, I really encourage you to reach back out to your specialist, to your allergist, to your rheumatologist, to your neurologist, and say, do you feel like I am safe to get the COVID vaccine? My hunch is they're going to say, yes, go ahead and get it, because I think it goes back to, the known and potential risks of the COVID vaccine are far less than the known and potential risks of the COVID virus. So I just really encourage you to reach out. I looked this up just last night. The American College of Rheumatology really recommends that patients with underlying rheumatological disorders get the vaccine. And actually it says not only should they get the vaccine, they should be prioritized to get the vaccine. So I just
Definitely.
really feel like that's important to say.
Yeah, I agree with that. And I would say, I definitely understand the apprehension. I think we all had apprehension. The residents that trained with me had that apprehension in December. Is it okay to be a little scared about getting this vaccine? I think that is normal. It is human. This vaccine has been well researched. There have been no steps that have been skipped. What has been skipped is all the red tape, the actual details and hoops have been streamlined instead of having them zigzagged all over the place. Everything has been straightforward about getting this vaccine studied and produced. So I would encourage each and every one of us to consider this not just about ourselves. Think about if you have that virus and you affect 6 or 10 or more people and they affect 6 or 10 more people, somewhere along the way, we're going to affect someone that couldn't protect themselves. And I think that is a really critically important piece for all of us to think about. It's whether you want to look at it from Dr. Jenkins' war perspective, if you want to, we are the volunteer state. It's all of those pieces rolled into one. I think we have a responsibility to look out for our fellow man. And this is the one thing that we know we can do. None of us want to stay inside. None of us want to avoid everyone. It's the one thing that has been shown definitively to work. So I would strongly encourage you, if you're uncomfortable with the thoughts of this after hearing us, I would encourage you to reach out to your primary care doctor, reach out to your specialist, communicate, really dig in deep to the factual information. There's a lot of competing information out there. So sit and talk with your provider, that person you trust to give you truthful, honest information. But I would encourage you to strongly consider this vaccine.
Absolutely. There's a saying in medicine that you don't want to be first and you don't want to be last. A lot of y'all out there are potentially going to be last. So at this point, we've had over a year of being able to look at this. It seems like we've had, millions of people who have received these vaccines and done excellent. As Dr. Piel alluded to, the contraindications, the reason to not get the vaccine on a comorbidities basis are incredibly minuscule and very, very small. I highly encourage, again, speak with your specialist, your primary care doc, have that individualized conversation. Please don't rely just on what you read out in print, because medicine is complex. It's unique, it's individualistic, and talk with someone who has the expertise that you can trust, who knows you, that can guide you well. I assure you, we've given the best years of our life to helping people. We're passionate about this, and we love it. I wouldn't stand by something that I myself wouldn't do or wouldn't recommend to my family as well. We truly mean this out of the goodness of our heart. And I just hope y'all consider vaccination, and please, send me extra questions or concerns on. We're always here to help you. Certainly no judgment on this by any means. We're here for you.
Thank you all for taking the time, and we'll continue to monitor questions as they come in and share those with you offline.
That would be excellent. Thank you so much.